Tell me, did you know that some foods we eat, even our healthy choices, can negatively impact on certain medical conditions? Also, some foods alter and can even reduce the effectiveness of some medications. Something as simple as eating a vegetable can help in one situation, but can cause problems in another. While you're being intentional about eating right and healthy, if there is an underlying medical condition and you're placed on a medication, you don't want to compromise in any way your health. Therefore, it is important to understand the connections between our food, health conditions, and the medicines we take. In this video, I'll be sharing on how certain foods can strain a drug's effect, weaken it, or make health conditions worse. I'll also talk on why certain people may need to adjust, limit, or seek other options for food to maximize their nutrition. Hi, I'm Dr. Francisca Osage. Thank you for joining me on Francisca on Health Matters. During our clinical visits, the questions asked by the healthcare professional are not just routine. They help guide important decisions regarding our care. And so questions might seem unrelated at first, but the answers we give strongly influence the plan executed by the healthcare professional. And so information or decisions on the most appropriate treatments, the medications, or the most appropriate counsel are strongly influenced by the answers we provide. Information on allergies, list of medicines, or pre-existing medical conditions can influence decisions. And when necessary, counsel might also include alterations to food due to certain medications or pre-existing medical conditions. So let's look at some common medications or medical conditions that may require extra guidance on the foods we eat or certain dietary choices we make. Let's start with warfarin. Common brands include Coumadin and Gentovin. Warfarin is a medicine that reduces the blood's ability to form clots. Medicines in this group are called anticoagulants, often referred to as blood thinners. They help prevent dangerous clots from forming. Now, clotting is a normal safety response initiated by signals within the blood with the goal to stop bleeding, especially after a blood vessel injury. A vital requirement for this process is the nutrient vitamin K, which the body can obtain from foods such as kale, spinach, collard greens, broccoli, and Brussels sprouts. Clot formation, however, can become a problem when abnormally formed within blood vessels and thus blocking blood flow. Now, this risk rises in certain situations, including a state where there is poor blood flow, also described as a state of stasis, or there's blood vessel injury, or the body is in a state where it easily forms clots, also described as hypercoagulable state. Now, typical examples of these include conditions of atrial fibrillation, kidney diseases like nephrotic syndrome, recent surgery or trauma, certain cancers, certain pregnancy complications, prolonged immobility, as in bed rests, long flights, taking long trips. Warfarin works by reducing the activity of what is described as vitamin K dependent clotting factors, simply because these blood factors require vitamin K. And that is why a substantial change in the levels of vitamin K can influence the efficacy of warfarin. Now, the need to take warfarin is at the discretion of the healthcare provider. Likewise, adjustments to diets. It's never advisable to take any medication without a consult of your healthcare provider. Next is kidney stones. A stone is formed when certain substances in the urine become concentrated and crystallize. The nature of the stone is dependent on the substance. The common types of kidney stones are composites of either calcium oxalate or uric acid. Now, there are certain people that are easily prone to having a stone. Oxalate stones are likely to be present in susceptible individuals, and this risk increases with excess consumption of foods high in oxalates. And these foods include spinach, beets, Swiss chard, soy products, almonds, potatoes. Also foods high in sodium, such as canned soups, heavily salted processed foods, foods high in animal protein, such as red meats, organ meats, some seafoods. Now, measures such as consumption of foods high in calcium can help, and these will include foods like milk, cheese, yogurt, calcium fortified foods. Also, consumption of lots of water and unsweetened fluids can help. Next is hypothyroidism. Hypothyroidism is a condition of hormonal imbalance with thyroid hormone, a hormone at the center of the body's metabolism. The effects of hypothyroidism include fatigue, constipation, weight gain, cold intolerance, dry skin, and slow heart rate. Iodine is a vital ingredient in the production of this hormone. Thus, foods that will interfere with the production of iodine can influence this condition. Such foods include raw cabbage, broccoli, cauliflower, kale, and bok choy. These contain compounds described as goitrogens. They contain glucosinates, which when broken down can form compounds that reduce iodine uptake by the thyroid, interfere with thyroid hormone synthesis, and this interference can contribute to thyroid enlargement. It's important to note that cooking reduces goitrogenic activity as heat deactivates some enzymes involved in forming these thyroid interfering compounds. Next, we have irritable bowel syndrome. A brief description of this condition is that it's a common disorder of the bowel causing abdominal pain, bloating, constipation, and/or diarrhea. Now, this condition can be made worsen by foods containing short-chain carbohydrates, as these draw water into the intestine, get fermented by gut bacteria, cause gas, bloating, cramps, and diarrhea. These foods include onions, garlic, cauliflower, asparagus, mushrooms, and you have fruits like apples and pear. Next on the list is gout. Gout is an inflammatory arthritis caused by deposits of uric acids in joints, leading to sudden episodes of pain, swelling, redness, and tenderness. This condition can be worsened by purine-rich vegetables, and popular in this list of vegetables are mushrooms, spinach, and asparagus. Purines metabolize into uric acids. This is what can trigger gout flares. Gout can also be triggered by red meat and organ meat, certain seafood, sugary drinks, and alcohol. Now, if you're one easily susceptible to gouty attacks, pay attention to that list and be mindful of consumption of those foods. It's also helpful to drink lots of water. And yes, we have the blood sugar disorders. There's so much to unload when it comes to type 2 diabetes, and it's best to have that talk with your dietitian. However, a general rule of thumb is be cautious with foods that have high glycemic loads, as they lead to rapid blood sugar spikes. Common foods that may spike glucose include sugary drinks, as you have in sodas, sweet tea, fruit punch, energy drinks. Also, refined grains and starches, such as found in white bread, white rice, regular pasta. You have highly processed breakfast foods in sugary cereals, pastries, pancakes with syrup. Be mindful of sweets and desserts, as in candies, cookies, cakes, donuts, ice creams, and processed snack foods, as in chips, pretzels, sweet granola bars. Also be mindful of some starchy vegetables in large portions, as you have in potatoes and fries. A lot of starchy foods have high glycemic loads, and so what's important is the portions served and how these are incorporated with other nutrients such as proteins, fiber, and healthy fats to create a balanced nutrition. And lastly, I will briefly mention a group of drugs called beta blockers. Beta blockers have a wide application or clinical indication, but they are most commonly used for control of high blood pressure, heart failure, and after a heart attack. And some beta blockers are useful for migraine prevention. And common examples of beta blockers include metoprolol, atenolol, carvedilol, and propranolol, which has a wide application. And when it comes to food interactions with these medications, there's a concern for a possible rise in blood potassium levels, otherwise called hyperkalemia, especially in people who have diabetes, who suffer kidney diseases, and who are taking drugs that are also capable of causing increase in potassium levels. Hence, caution is drawn to foods that have high potassium stores, and these include potatoes, tomatoes, spinach, beets, beans, bananas, oranges, avocados, and dried fruits. A high potassium level is of concern because it affects the way the heart and other muscles work, increasing the risk of abnormal heart rhythm and muscle weakness. Of course, there's a wide range of drug interactions with food and varied impacts of food on medical conditions. Vigilance is key. Always report any unusual observation when taking medications or experiencing any health conditions with your healthcare provider. So that's it for my video today. Please do like and share and subscribe if you get to subscribe so you can get more of my wellness content. Thanks for watching. Again, I hope you found this informative and educative. And if you've had, please like and subscribe. And I'll see you in the next one.